So I think most of you know me. I'm Corinna and I'm one of the children's diabetes nurses in Cardiff, and I take the lead for the schools education. And last year we set up a schools working group to represent the needs of education going to schools across Wales. So I want to just give you a bit of feedback from that group. So we set ourselves up last year and we've got representatives from all of the health boards, and I think they are mostly nurses. We've got a few dietitians, we've got parent representative, Josh comes from Diabetes UK and sometimes with Leanne as well. So we've got a good representation across Wales. And what we wanted to achieve is looking at how we can improve the experience of care of children with diabetes in schools. We wanted to review the standards of our approach to the school support and education that we deliver. And whilst we appreciate that there's a variation in delivery and that's acceptable, what we don't want to see is a variation in the quality of the support that we provide to schools. So what we achieved during 2019, I think we had 3 meetings, and what we managed to achieve during that year is that we've had a safety memo that's now included in all of the school care plans across Wales, and this safety memo outlines the responsibilities of schools to ensure that medication is stored safely and securely. We've also agreed and circulated an all-Wales response to the training of intramuscular glucagon in schools. And we are also, well, John, I thought you were going to talk about the website today, or is that coming next? Am I about to steal your thunder?
No, that's fine. I'm not going to mention it.
No? Okay. So there is going to be a new website being launched for the network, and within that website there's going to be a specific school section, and there will be these policies and memos all available, freely available on the website once it's live. So for this year, we're planning to continue with our meetings. We hope to meet between 3 and 4 times this year. We're willing to have any new members, so if anybody else wants to join our group, you're very welcome. Or if you just want to offer ideas of things that need to be discussed, then please, you can just email that over to John or over to me, and we will include it in our agenda. Items on our agenda coming up for next week we're meeting. We're going to be talking about alert dogs. Somebody's raised that as a possibility that might be something to cover in schools if children have got alert dogs or thinking about alert dogs. How to standardise carb counting across school, and also looping, because that is going to be becoming more and more popular. How do we ensure that school staff are supported and covered with this technology that we're just dipping our toes in the water of as well? That's going to potentially be a little tricky whilst this technology gets developed and we understand it. We're also planning to develop an all-Wales guidance for the management of diabetes at school, and that's going to be developing the draft document that Swansea Bay University have put together. It's already a fantastic document, but we want to try and make it available to be suitable for all health boards, and we think that can then also become what we can submit for peer review as well as our policy document. And then exams at school. I don't know if for those of you who were at BSPED in November last year, we had a student in Cardiff who presented the project work that she had done back in the summer of last year, and she had uncovered that schools were not aware of the Diabetes UK exams resource. I've got a few here, and Josh has brought a whole loads. If anybody wants to take some of the exam resources booklets with you at the end of the meeting, you're very welcome. So Hannah discovered that not only were schools unaware of the resource, parents were also unaware as to how stressful their teenagers were finding the exams, and the teenagers were being very open about how stressful they found the exams and the knock-on effect to their diabetes. So what we've done in Cardiff is we've written to all of the high schools who have got children in years 10, 11, 12 and 13 and included a copy of the resource, so sent it to the heads of year and also the exams officers in the hopes that it's going to just put it in people's inboxes and that they're going to do something about ensuring that students have the appropriate access arrangements. And we haven't had any feedback yet from the schools whether they've had the booklets, whether they're doing anything differently as a result of receiving the information, but that is ongoing work that we're planning on doing in Cardiff. We've also recently been to a meeting for the Care in Schools Alliance group, which Tristan from Celiac UK made reference to this morning. So just a bit of feedback for you from that group. The ALN Act is now going to be delayed in its implementation. It's going to be delayed to January of next year. It was going to be implemented by September of this year, but it's been delayed to January of next year. And the framework will go live in September of next year. So there will be changes afoot for us. And we are hoping that we're not going to uncover any difficulties in ensuring that our children with type 1 diabetes are seen as having ALN. Welsh Government currently don't have any plans to update the Supporting Learners Guide, which probably most of you are familiar with, but there is a possibility that they may allow it to be updated when the ALN Act framework goes live in September 2021, and we're hoping that they will allow some input from relevant parties like ourselves, but they haven't been very forthcoming to date, so we will keep on banging on their door. Diabetes UK are going to be developing some resources and booklets for schools and parents to make sure that everybody understands what ALN means and how our children can be ensure that they do get the ALN provision. Celiac UK, Tristan mentioned this morning about their resources for schools, so we mustn't forget to include those for our relevant children when we're making our healthcare plans. And they were also at the meeting telling us about a working group that is currently looking at special diets in schools across Wales. Currently, there's no national guidelines available for schools to work towards on how to ensure that children with special diets get what they need. And special diets currently cover gluten-free diets, diabetes, allergies, and a ketogenic diet. So they're looking at developing national guidelines for those children with those dietary requirements. But they're also going to be looking at children with additional dining needs, which I thought was rather interesting, and that's going to cover children who have got dietary requirements associated with their religion, vegetarianism, veganism, or if they've got requirements for special textures or for special environments. So I would imagine that's covering the children within the autistic spectrum disorder group.